Ladies and gentlemen, I'm going to tell you something about the tonsil problems. Tonsils, they are two, you see, guard in the throat. Basically, it is a lymphatic tissue. It protects the body from the infection. But when they are infected, especially in the, you see, school-going age, when the child starts going to the school, he gets off and on fever with severe throat problem, like such something like this, as we can say, high-grade fever. The mother come to the clinic of the doctor and say that the child is suffering from high-grade fever. When we inspect the throat, we see the tonsils, they are inflamed, they are having the infections. White patch you can see in the throat. This is all due to, you see, some problem related with the tonsillitis. Tonsillitis is such a problem which can cause so many problems. It is a problem which gives to so many problems. It can cause the discharge of the ear, the small children, especially 4 years, 5 years, 6 years, their tonsils, they become infected, then the infection travels to the middle ear and causes perforation, the drum. Ears start discharging. Also, they get some other problem like joint pains. Then some problems related with the kidney and with the heart can also happen, because this tonsil problem is going to give so many other problems. It is an international saying. Don't take it lightly. Tonsil should be taken as a serious matter in the child when they are infected. Infection in the tonsil gives rise to a problem which is called as tonsillitis. When there is a supposed infection in the appendix is present in everybody's abdomen. But when it is infected, it's called as, and getting the, you see, inflammation, appendicitis. In the same way, tonsils, practically they are present in every human being. One on the right side, the other one is on the left side. When they are infected, they give rise to the inflammation of the tonsils, which is called as a tonsillitis. Now we have to select where to do surgery and where not to do surgery. Surgery is sometimes inevitable, as there is sometimes peritonsillar abscess. One single attack of quinsy or peritonsillar abscess is a clear indication that we should go for the removal of the tonsils. Otherwise, there are so many other yardsticks, parameters the surgeon has to assess according to the previous, you see, experience. Tonsillitis gives rise to so many other, you see, complications, like the child is coming with the ear discharge, sometimes even blood is coming. They say that this education is being disturbed, off and on fever, in a month, 1 or 2 times even. If you are getting a fever off and on, and you write an application to the, you see, principal or, you see, head of the institution, the child is not well, I think then you should visit the clinic of the E.N.T specialist also. He should then do some proper inspection, then various investigations. Investigations will be telling that he is suitable for tonsillectomy operation or not. There are some absolute contraindications, some indication where we can not go for the surgery, suppose like bleeding disorder. But routinely, I don't think so. That 9 out of the 10 patients, they are okay. It's an operation done under the general anesthesia. Patient is put on the operation table, anesthesia doctor comes, anesthetist, he is going to give him the anesthesia. Then the patient is not getting any pain or difficulty. Then the surgeon sits at the clinic, that the head-end tonsillectomy operation is very easy. I perform within 5 to 10 minutes. Patient is okay, he is out of that problem. We should not stick to the problem, but we should be out of the problems. I will say that I have worked in the MAYO hospital for a long time, in all the capacities, registrar, senior registrar, assistant professor, associate professor. There I used to see the patients. When they are coming, I used to mark them, advise tonsillectomy. Patient used to get admission in the hospital, in the indoor E.N.T department, MAYO hospital. There the patient is prepared for the surgery. That procedure is called as the pre-op, the preparation of the surgery. Next day, patient is operated. I think so there is no problem. Tonsillectomy is like appendectomy, very common operation in the human body, but gives very good result. The patient is okay in a very short time and he start going to the school. I think so the parents should take a proper precaution, as the health is wealth. Education is not wealth. And if the child is having good health, he will be a rich man in every respect. If he is not having good health, suppose due to the tonsil, his ear is affected, or his joints, or even sometimes heart or even kidneys, they are also affected by the tonsillitis problem. I will advise them, take the quick decision, take him to the proper E.N.T specialist. Now there are E.N.T specialists at every DHQ level. They are giving a very good service. And I tell you, it's the most, say as an operation is the operation in which we get maximum benefit for the child. I organized third SAARC E.N.T conference in PC Hotel Lahore, a first time in the history of Pakistan that any SAARC E.N.T conference was organized. I was the Secretary General. I organized single-handedly, and the collection of people that came in that, especially Professor John J. Wright, who was our world president. He came from Netherlands and read the state-of-art lecture on the tonsil problems. Tonsil problem is a global problem. It's not local or European or Indian or Australia. Everywhere you will go, you can find this problem. However, Professor John J. Wright, you can see him, he is delivering the speech in the third SAARC conference, which I organized, in which Professor Alauddin, he came from Bangladesh and brought about 40 consultants from Bangladesh, and they had also given the maximum importance about the management of the tonsillitis, because the children, maximum they are being affected in Bangladesh, India, Sri Lanka, wherever I went. When I went to the for the fifth SAARC E.N.T conference to represent Pakistan there in the New Delhi in ASHOKA hotel, you can see I am chairing the scientific session where the main topic was tonsil problems, how we can solve it. The sitting with me in the scientific session is Admiral D.K. Singh, their DG Armed Forces Medical Services of India, and then the other one is Professor Venkat. He is the President of E.N.T of India. They gave maximum importance to this. The decision of the tonsillectomy operation should be done as early as possible. It should not be delayed so that the complication should not occur. Then I represented Pakistan there in the World E.N.T conference in New York. This was the main, topic for tonsils, again in Jacob Convention Center, where Professor Jennifer, the world president, she was also there. She said this is the main problem of the tonsil, that giving complication in the ear. Central perforation, if the child comes in the outdoor with discharging ear, then instead of operating the ear, we should go for the tonsillectomy operation. Tonsillectomy operation will respond to tuberous disease of the ear. If you remove the tonsil, the ear will become dry. There is a child of 6 years, 8 years, not fit for mastoid operation. Then go for tonsils removal. Child will be okay. He will be going to the school and then becoming good, in health. His height and his build will be okay. Otherwise, he has to take repeatedly, antibiotics. Then there was a conference in Colombo also, in Sri Lanka. This was the fourth SAARC E.N.T conference where I was elected as Vice President of the SAARC countries. It was a big honor for the Pakistan that a person represented first time in that international event, and I got elected by all the participants from 7 countries. However, there again they talked about the tonsils problem. Because tonsil is the main gateway to the body. When I used to sit in the MAYO hospital outdoor, 10 patients, if they are visiting, 5 people they are coming with the throat or tonsil problems, 2, 3 with the nose, 1 with the ear. Most common part in the E.N.T is this gateway to the body, which is called as the throat. However, then there was a conference at Turkey also. It was there in Ankara, which is the capital. The state of art lecture was done by the, delegates which came from Italy. They said that it should be very vigilantly watched, that tonsillectomy should be done in time. If you delay it for indefinite period, due to the fear that the parents will become frightened, you should convince, a E.N.T doctor should convince the parents that don't waste their time of the child, the health will be spoiled. However, then you can see, I'm standing with those delegates who advocated for the tonsillectomy operation. If there is a need, it should not be delayed. You can see me standing with those, topmost people. Then again, I came to the Malaysia, in Kuala Lumpur. There, the hot topic was again the tonsil problem. And it is also giving some problem in the ears and deafness. They said tonsil, if they are managed properly in time, then the child will become a good, adult person, then he will have a good life, then there's no problem. But if he is getting the problem of, tonsils and infection travels from the tonsils to the, middle ear, then ear discharge, then it is very difficult to manage it. A small operation of tonsillectomy, I performed. You can see that this is my E.N.T hospital on the J Road. I am just opposite to the Kinnaird College, Lahore, Pakistan. This is the E.N.T where I am working for the last 30 years. We have done thousands of operations. I also operated, and the other E.N.T doctor used to come to my hospital, this Rana E.N.T hospital. They used to come, and we have been doing the good to the people. Now they are, mashallah, okay. The children are okay. The parents are happy. But if you don't remove the tonsil and start only giving the antibiotic white or red or green color syrups, no, they don't work. But they prolong the tonsillitis problem, and ultimately the child gets so many complications. Thank you very much.